Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Tonight's topic is the core of medicine, family medicine. My co host and moderator of the chat is Dr. Dan McCarter. Welcome, Dr. Dan.
Hey, Faisal, it's great to be with you again this evening.
How are you doing tonight?
I'm doing well. I'm doing well.
Boy, this pre-show, before we got started, I was just thinking these last couple weeks have been unbelievable. Bouncing around all over the place. We're getting back out again.
Absolutely, absolutely. And we have an exciting guest this evening.
Very exciting guest. I'm so glad that we could make it work for tonight. Let's welcome Sterling Ransone. Sterling, welcome so much.
Thanks for having me.
It is so great to have you on the show. I know the last time we had some technical difficulties, but we're back on today.
Well, I'm an employed physician, and I have this little broadcast studio set up in my office, and unfortunately, through our Ethernet, there was this huge firewall, and they just could not fix it, so I could get on. So my apologies. And I was like, well, I could run home, but it's about a 20-minute drive. I'm out in the country, and you guys very kindly said, please don't rush home and kill yourself.
Oh,
So,
no, no.
so I'm glad we could set it up for tonight.
Yeah, sure. And so Dr. Ransone, like I'd love to hear your story. How did you become a family doctor, and then the path to where you are today?
Wow, that's a great question. So, I'm actually a third generation family physician. My grandfather was a family physician, and he went to Roanoke, Virginia, where he had his practice and did public health. My dad grew up in Roanoke and moved to Matthews, Virginia, he was a family doctor there for 33 years, and that's where I grew up. When I went off to medical school, I met a physician who's now my wife, and I actually have a fourth generation soon-to-be physician who's a first-year med student. So we're covering lots of bases. But when I was a kid, I wanted to be an astronaut. So this was late '60s, early '70s. I wanted to go to the moon and decided that's what I was going to do, and realized that really wasn't going to work, and the whole professional football player part wasn't going to work. And when I looked at, where I grew up and how I grew up, I mean, I grew up, I had, I guess, somewhat of a science aptitude. I liked it. And when I thought, well, what could I do that could, give back to my community that I grew up in and incorporate science? Well, physician was the thing to do. So went to med school, looked around, and I loved everything. I loved delivering babies. I loved surgery. I loved it all. And so, near the end of third year, just when I thought about what can I do that would allow me to move back to a rural area in which I grew up, would allow me to do a little bit of everything, and really, go back and help the people that helped raise me. Family medicine was the way to go. So went to residency and moved back home. It was it. A lot of folks think, well, oh, this is, you're going to do this your whole life. I really went into it all with an open mind, but after seeing kind of the joy of broad scope medicine, family medicine had to be the specialty that I picked. So the rest is history.
It's one of the things that we hear so common with doctors who pursue family medicine. It's like you love doing the procedures, you love the interactions with the children, delivering babies, and it's a wonderful. I mean, it's just so diverse, and actually, so I'd like to know now what your path from becoming a family doctor towards getting to where you are right now.
Ah. So that's actually an I don't know if it's interesting, but I think it's an interesting story. I was happy. I'd moved to the area in which I grew up. I was practicing medicine. At the time, I had two and a half kids. And one day I was in the office, and I got a call from the pharmacy, and I'd written a prescription for something. And they basically, it's one of these things where, you figure it's going to be a prior auth, and what do I need to fill out now? And the pharmacist said, no, the insurance company will not allow this prescription because it is written by you. I'm like, "Well, what do you mean?" Well, they would not allow a prescription that was written by a family doctor. And quite honestly, it made me mad. So my patient had to take another day off of work, drive half an hour to see a specialist who looked at him, looked at my note, wrote the prescription, and he was out of there in less than 2 minutes. And I got really PO'd because I'm a specialist. I have 3 years of residency training, and the big insurance company, they would not recognize this expertise in my field, and so I got kind of mad and called the insurance company. What happened? Well, nothing. So I looked around and eventually went to our state medical society and said, "Look, this isn't right." And I wrote a resolution, and I was all steamed and basically saying insurance companies should not be able to infringe upon the prescription authority of a physician. And it passed the medical society house of delegates. Turns out some other people had similar issues. It became policy, and that policy, the medical society went to the insurance company and said, "Look, we've got this policy that we just passed. What you guys are doing isn't right." And the insurance company actually changed their policy. And the next time I had to write that same prescription, they allowed it. And it took about a year, but after that, I was hooked because as an individual physician, I got nowhere. When we had the power of a lot of physicians, rowing in the same direction, we actually could achieve a change to the system. And so after that, I was just hooked on organized medicine and doing things that would that would better the practice environment for physicians and better patient care for all my patients. And that's how I got started. Then I think I got started. I hate to say it, but it's because I was angry. Now it's having seen what can be achieved by physicians working together. I really think we can achieve great changes in our healthcare system so that all of our patients can get the care they deserve.
Wow. That's what it takes. Sometimes there's this inciting moment that just, hey, we're gonna drive change, and you can create this movement for justice. I feel like a lot of why physicians, especially with family physicians, are where we are. It's because um, we've kind of been bullied out of the healthcare delivery system.
Yeah, sure. I agree. When you look at our member surveys and we look at what are really, what's the top thing that family physicians get concerned about, it's administrative burden. And by far, I mean, and for the last 5 years at least in our survey, that's topped the list as far as the concerns that family physicians have. And when you look at just what we have to do, I mean, when you pass for over half of the time, what was I trained to do in residency? I was trained to take care of patients. And I was trained to sit and listen and analyze and put puzzles together to figure out what's going on with this patient. Sometimes they come in and they come in complaining of a quote sinus infection. And the real reason they're there after watching their body language and talking to them is because they're depressed because they're being abused at home or something along those lines. And it takes a long-term longitudinal care and trust in their physician for these folks to come in. And that's the kind of system that we need to have in order to give our patients the best care. But that's not how we're reimbursed. We're reimbursed for the churn and the grind and get patients in and out. And what patients want, they want someone who will listen. They want someone who will sit and hear their problems. They don't want someone who's going to just come in and say, "Okay, yeah, you're right. You have a sinus infection. Here's your Z-Pack, and off you go." Now, there are some folks obviously who want that, but that's not giving the best patient care. And I think the patients know that.
Yeah, and the doctors do as well too. I mean, the
Yeah. Oh,
trust is gone. When you don't, even the language it sounds transactional. I
oh.
mean, my
Mhm.
old my main where I used to work in many clinics as well, they refer to patients as clients.
Yep. Customers.
Yeah, doctors are providers.
Yeah.
Even the visits are no longer visits between them; they're called encounters.